There are still so many things we don't know about COVID-19, including how we can trace it and understand how it spreads, but leave it up to great minds in Minnesota to try and figure it out. This morning, our newest Minnovator is Dr. Glenn Simmons Jr., an assistant professor in the Department of Biomedical Sciences at University of Minnesota Medical School's Duluth campus, who's come up with a way of testing wastewater to help trace the spread of the new coronavirus. Dr. Simmons joins us live this morning by Skype from Duluth. Thanks for being with us. We appreciate it.
Oh, thanks for having me.
All right, most people don't like to get too in-depth on wastewater and what kind of testing we're doing here, right? But tell us kind of what you and your team have come up with.
So far, we've taken advantage of the very rapid biomedical response across the country and across the world to find ways to overcome the bias in the person-by-person testing method. And so a study early in February that was done in the Netherlands gave us the idea that looking at the wastewater is something that's feasible. And so far, what we've done here in Minnesota has really taken advantage of the fact that Minnesotans are really very willing to help out. And so we've created a network of different facilities around the state that are now sending their samples to us, and we're working to determine how much we can actually see based on the levels of infection in different communities.
So you're getting samples from different municipal wastewater plants, because here's the problem with the way that we're testing now. I mean, these test numbers are very difficult to interpret because the people who are showing up to be tested are either likely to be sick or they're in, populations that are more at risk. But the rest of us might have coronavirus and not know it.
No, that's exactly right. That's one of the major limitations. So if a person knows that they want to be tested, but for some reason can't get to testing, their numbers will never count. And so that means that our numbers in terms of the actual infection are almost always going to be slightly higher than what we're reporting.
So are we flushing evidence of coronavirus down the toilet? Are you finding anything in the wastewater that would give you a hint as to what's happening?
So thus far, we're just getting started. We've just formally gotten our laboratories back open up here in Duluth, because once the outbreak actually started and we started getting to that state of being sheltered in place, the University of Minnesota basically funneled all of its resources towards making sure that we had a robust testing capacity, which I think was a very good approach to start everything off with. And so we've just recently gotten our permission and our safety clearance to start opening back up. And so we've just getting started about this last week.
Cool. So this is really the next step that may give us answers as to how widespread coronavirus transmission is. Must be exciting. For a scientist, this must be super exciting.
No, absolutely. I mean, as a scientist, the one thing I think we're always kind of accused of is being lab rats, kind of not being involved on the front line and being shut away off playing with our different molecules and cells and stuff. So this, for me, is a major change of pace where I'm able to engage with the public and have these conversations that have effect in real time.
Yeah. Dr. Glenn Simmons, you are a Minnovator. Thanks so much for being with us. We appreciate it.
Thanks for having me.